All right, picture this. There's a political live stream, and it's promising a huge announcement from Donald Trump. You're probably thinking, okay, this is going to be some kind of political bombshell. But what actually happened was, well, it was a wild mix of nitty-gritty healthcare policy, some really strong opinions, and then this totally chaotic ending that left everybody scrambling. So let's break down what was actually said.
So what was this big secret, this major news, and how on earth did what looked like a standard press conference just completely implode on a live stream? That's what we're going to dig into. We're going to piece together the announcement itself and the, frankly, bizarre way it all ended.
So before this press conference even kicked off, the hype was real. I mean, the streamer who was broadcasting the whole thing live was speculating right along with his audience, trying to figure out what in the world this could be about.
And his best guess? A huge, game-changing plan to finally end the Senate filibuster. You know, that political maneuver that can basically bring a president's entire agenda to a screeching halt. It's a big prediction, for sure, and it fit the hype.
The actual topic had nothing to do with Senate procedure. It was all about something that hits a lot closer to home for millions of Americans: the absolutely insane price of those new weight loss drugs. And here it is, the big reveal. Right from the get-go, Trump announces this deal with some of the biggest drug companies in the world to dramatically cut the prices of GLP-1 drugs. And you know what those are? We're talking about the ones you hear about everywhere, like Ozempic and Wegovy, that have just exploded in popularity for weight loss.
Watching breaking news there, President Trump is announcing major deals to lower the cost of GLP-1 medications for many Americans. The deals with pharmaceutical companies Novo, Nordisk, and Lilly will lower the cost of GLP-1 drugs and include the costs both for the government and for consumers. The president's promising patients will pay the lowest cost in the world. Right now, GLP-1 drugs cost roughly $5,000 out of pocket for those without insurance. Let's bring in ABC News medical contributor Dr. Alok Patel for more. Dr. Patel, President Trump is really touting the results of these drugs. What do you say to patients when you're talking about using them?
What we want to make sure that patients understand is that these drugs are still supposed to be prescribed alongside some form of lifestyle modification and medication. I think that's the most important thing, is that it's not just the drug, it's got to be alongside diet and exercise. But also, we have seen, not only with GLP-1 drugs, Diane, but a lot of other medications, that patients are having trouble affording them, are doing whatever they can to get these options, whether that is going through special plans or potentially getting them off-label for another use. But regardless, this is a step in the right direction for a lot of people who may not be able to afford these drugs. President Trump is talking about coverage through Medicaid and Medicare, and it's important to note that historically, there are no drugs approved for Medicare reimbursement solely for weight loss. So if that goes through, this will be the first of its kind. And I want to echo the sentiment that this will reach a lot of people who potentially need these, who don't have the means, especially in rural and underserved areas.
So why these drugs? Why now? Well, the way the speakers presented it, this deal was their big weapon to fight two major crises that they see as totally interconnected: obesity and the crazy cost of medication in America.
Yeah, so this is something that will launch next year. The president was touting this as a way for people to go, if they don't have insurance, to purchase these drugs through that option online. The president saying that it would be about $350 at that point, as soon as it launches early next year, at that point when you get your supply of it. Notably then, the cost will keep going down. It will go down over the next couple of years, $250. And this is for people who have no insurance, who are paying completely out of pocket, different than what the doctor was saying there about people who are trying to get coverage through Medicare, of course. But this is an attempt by the administration to try to talk about how they're bringing down costs for Americans. And we saw with the election results this week, Diane, that the economy is the top issue right now for so many Americans. And we saw with the election results this week, Diane, that the economy is the top issue right now for so many Americans. And it was a big issue that was driving people toward Democratic candidates.
And to really sell this deal, they started painting a picture of the problem with some pretty jaw-dropping numbers. They were framing this as more than just a policy tweak. This was, in their view, a critical, necessary intervention.
And there was a sense that perhaps the president hasn't been focusing on what he has been doing since taking office on the issue of affordability. It's something he ran on last year. It's something he talked about as soon as he took office in January. But the president even yesterday was saying he doesn't feel he's getting enough credit for the things he is doing for Americans on the issue of higher prices. So this is something that is obviously very important to many Americans. And you're going to hear the president touting this in the coming weeks and months as this starts going into effect.
First up, Robert F. Kennedy Jr. dropped this bombshell: a full 50%, half of all adults in the United States are now considered obese or overweight. He called it the #1 cause of chronic disease.
And then you flip over to the money side of the problem, and the number is just as staggering. They claimed that for certain really popular drugs, Americans are paying as much as 520% more than people in other countries for the exact same pill.
Okay, so they've laid out the problem pretty clearly. Now what about the solution? Let's get into the actual nuts and bolts of what this new deal would look like. The biggest price drop they showcased was for a drug called Zepbound. Look at this. The monthly cost would absolutely plummet from over $1,000 all the way down to just $346. That is a massive difference.
I can tell you that David Ricks is one of the hottest people in the world in business, but the business that he's in is pharmaceutical. And the job he's done with Eli Lilly is incredible. Both of these gentlemen, they really are stars in the truest sense. And it's an honor to have you in the White House. And go to it, Bobby.
Thank you, Mr. President. I want to start by thanking you, Mr. President, for declaring war on chronic disease in this country. This is something no American president has ever done. If we want to solve the chronic disease crisis, we have to tackle it, obesity. Obesity is the #1 driver of chronic disease. 50% of our adult population are obese or overweight. It drives about 50% of healthcare costs in this country. Diabetes, cardiac diseases. We are going to see a decline because of this historic agreement. We're going to see a decline in costs, but also, more importantly, in the afflictions themselves. President Trump is the friend of the forgotten American. Obesity is a disease of poverty. Overwhelmingly. And these drugs have only been available for people who have wealth. At one point, the majority of prescriptions, the highest concentration of prescriptions in this country, was the Upper West Side of Manhattan. And what about the people who live in rural areas, who live in food deserts? What about the people in urban areas who live in food deserts and are suffering from obesity and are locked into that system where they can only get ultra-processed foods, which are aggravating the problem? This will be a lifesaver to them. It's not a panacea. It's not a silver bullet. President Trump has also instructed us to address and end the root causes of chronic disease, and we're doing that. We're about to release dietary guidelines that are going to change the food culture in this country. They're going to change the kind of food the military gets. They're going to change the kind of food that our children get. We're releasing those in December. The Presidential Council for Physical Fitness is going to get more Americans into, particularly our children, into physical activity so that we can attack the root causes of this. But in the meantime, there's nothing more important than we can do than lower this price. As I said, it is the #1 cost of all drugs. This is the biggest drug in our country. That's why this is the most important of all the MFN announcements we've made. This is going to have the biggest impact on the American people. All Americans, even those who are not on Medicaid and Medicare, are going to be able to get the same price for their drugs, for their GLP drugs. This happened because of the vision of David Ricks, of Mike Dustar, and the other people, and the people on our team who figured out a way to align the interests of the shareholders of their company with the health of the American public. And it is a momentous accomplishment. It took months and months of negotiations, and I had a wonderful conversation with Mike Dustar about his experience, and he thanked me for the caliber of people who are on our side of the negotiating team. Chris Klump, who walked away from $1 billion business in order to join this administration, Emma Hernandez, David Brooks, and of course, Dr. Oz and Marty McCary, who made this happen. They saw that this could be a win-win situation, that this was not a zero-sum game. The Biden administration tried to solve this problem unsuccessfully, I might add, by throwing $40 billion at it. And they were able to achieve an agreement that will actually create savings for the American public. So we're making all of this available at a savings, and that's because the price of diabetes prescriptions is also going to drop. And the savings that we get from that are now going to make it available to people who do not have diabetes, people who have a BMI of 27 and above, or pre-diabetic, or have heart disease risk. They will be able to get it, but everybody will be able to get this drug, and it's going to change. We will lose, the American public, because of this agreement, will lose 125 million pounds by this time next year. It is going to have dramatic effects on human health in this country. And I want to thank President Trump for his leadership. He said that I'd gotten a lot done as HHS secretary, but almost none of that is due to my ability. It's because I'm surrounded by people who are smarter than me, who are more able than me, and those people came into the administration because they were inspired by President Trump. People like Chris Klump are here because they see this.
You think they are smarter than you and
Yeah.
more able? No.
Believe me, they're a lot smarter than I am.
Why did you take that job? He doesn't really mean that he's being modest, I promise you, but
It is true, unfortunately.
it's a beautiful thing.
But I want to thank you, Mr. President, because you've made me a success here by allowing me to attract these extraordinary people. And I want to again thank David Ricks, who we've been in this Oval Office again and again. You keep saying he's the smartest guy in industry, that he could talk a dog off a meat truck. But it came to the table, and Mike Newstar told me, he said,
You convinced people for 20 years that it was okay for Europe to pay $10 and for America to pay $140. That's why they make $45-50 million a year. He did. Finally, I said, I've had it, right? You did. He did. But anybody could do that, and they're entitled. But now it's down to what it should be.
and Mike Newstar told me what a pleasure it was to negotiate with people who were smart, who had common sense, who were able to put themselves in his position and hammer out this deal that is good for everybody. And it's great for the American public. I want to close again by just saying that this is a tool in the toolkit. It is not a silver bullet. It is an arrow in our quiver. It will allow a lot of people who are locked into high-risk obesity to finally lose weight, to reset, and then start doing the kind of things that will address the root causes of obesity. So I want to thank these extraordinary CEOs for sticking with us on this, for allowing us to make this happen. Mike Newstar said to me, he said, we've known we've had to do this for many years. We just haven't been able to get over the edge, and that this President Trump's order, his executive order, was a catalyst to do something that we always knew needed to be done. So again, thank you for your vision, for your commitment, and thank you to all the CEOs and all of my team for making this historic agreement.
And it wasn't just that one drug. They laid out a few other key numbers. Any future oral versions of these drugs capped at $149 a month. For folks on Medicare, the copay could be as low as $50, and state Medicaid programs could get in on it for a flat price of $245. So the big question is, how would you actually get these prices? Well, the plan was pretty straightforward. They're launching a new website, trumprx.gov. They said you'd go there, and that would be your gateway to the discounted prices, with the whole thing expected to be up and running before the end of the year. And you can bet they sold this thing as a colossal win in negotiations. Trump basically said, you think it was easy to get these guys to drop a drug from $1,300 to $250? He framed it as this incredible achievement that, in his words, nobody else could have pulled off.
These are two companies that are behind the groundbreaking weight loss drugs that have helped millions of Americans struggling with obesity live better, longer lives, everything else. These are the two companies that really broke ground. Until now, neither of these two popular drugs have been covered by Medicare for weight loss, and they've only rarely been covered by Medicaid. They've often cost consumers more than $1,000 per month, and some a lot more than that. Americans have been spending as much as 520% more for Zepbound and 1,400% more for Wegovy than patients in Europe. Think of that. 1,400% more than a patient in Europe for the exact same box. And that ends starting today. The other countries are not happy with us. Now, I don't think they like me too much, Bobby, but that's okay. Eli Lilly and Novo Nordisk are committing to offer Zepbound and Wegovy at most favored nations rates for American patients. This will slash the cost of Wegovy from $1,350 a month to ultimately $250 a month. $1,350 to $250. Did I do a good job? They don't write about it. You know, they like to not write these things. And reduce, you think Biden could have done this? I don't think so. And reduce the monthly cost of Zepbound from $1,080 to $346. In addition, they're both committing that future GLP-1 weight loss drugs taken orally, which are currently under development, will be sold at no more than $149 per month. It's a massive, think of that. You go from $1,300 to $149 a month. We anticipate these new versions will be coming out in a very short period of time. All of these drugs will be available directly to the consumer at trumprx.gov. Trump, they want to use my name. Trump, it better be good. trumprx.gov. And I think it's turning out to be pretty amazing, right, Oz? Just as significantly, Medicare and Medicaid will finally cover the cost of these weight loss drugs for millions of patients suffering from obesity. Co-pays for Medicare patients will be as low as $50. This is tremendous savings. I mean, now you're talking about from $1,350 to $50. This is tremendous news for the American seniors. And you all remember when I had 1/8 of 1% for the year. I got it 1/8, and I was so thrilled. But now we're cutting at 1,000%, 1,200%. Nobody's ever seen anything like this. Nobody else could have done it, but I say that modestly. In addition, you think it was easy dealing with these people? It wasn't. You think it was easy saying, your drug, Mr. Eli Lilly, that we're selling for $1,300 is going to be sold for $250. You know the amazing thing, the stocks all went up. I mean, these guys they're fantastic. Because it's going to equalize the world. The world's a bigger place, and it's going to equalize.
And this is where it gets really interesting. The streamer broadcasting the whole thing had a completely different take. He immediately pushed back, saying he is not a fan of government price controls. His argument? Real price drops should come from the free market, from competition, not from the government stepping in. It was just this fascinating clash of ideas all happening live. Now, this whole drug deal wasn't just presented as a standalone policy. No, they tried to connect it to a much bigger vision for the country, and they even gave it a new name, MAHA.
So what on earth is MAHA? Dr. Oz actually got up on stage to define it. He said it's a movement all about making it easier for the right things to happen.
So we're going to go through some of the deal points, but it does make itself clear that the real stake here is the forgotten man. President Trump, I believe you won the election because you remember the forgotten man. You speak to them, they hear you, they listen to you, and he connects well because he actually does things that materially change their lives. Secretary Kennedy spoke passionately, as he always does, about the problems with obesity. And just to put some very fine point numbers on this, obesity itself is responsible for half of all chronic disease and definitely generates more than a quarter of all the money we spend out of CMS, the $1.75 trillion that we spend annually. We need to address this tempest of dramatically increasing prices for healthcare, and you're not going to do it just by throwing money at the problem. You have to actually literally deal with the causes of the increase in price, and pharmaceutical prices are a part of that. They've been a part of it for a long time, but this president insisted that we address it. In fact, the first time I heard this directly from you, sir, was in January at Mar-a-Lago, where he took Secretary Kennedy and myself, Mr. Ricks, who you'll hear from in a second, to dinner, and demanded explanations for most favored nation pricing and what's wrong with it. And there was not a good reason against it. Now, MAHA is critical. America will have to get fit in order to right-size the healthcare system, and MAHA has the answers. It has obesity management through diet and exercise and sleep and dealing with issues related to that. And I want to say it as clear as I can. Obesity is not an absence of GLP-1 drugs. We're all clear on that. But as Secretary Kennedy said, it is an arrow in our quiver that we must use and should use. The MAHA movement means making it easier for the right things to happen, easier for you to be healthy. If you're sitting at home and watching, that's what MAHA means to me. Reducing costs of the #1 most expensive medicine category in our country for Americans does just that. It is as MAHA as it gets. Today's the fourth MFN. President Trump highlighted the first three. leading U.S. company, leading European company. We've dropped in fertility drugs, so we'll make lots of Trump babies, I'm hoping, by the midterms. But it's really about fairness. Fundamentally, it's fairness in pricing to Americans who have been getting ripped off, paying 3 times more than their European counterparts for the exact same product made in the same factory, in the same bottle, in the same packaging. We shouldn't be paying 3 times more, and we are no longer doing that. Fairness to the forgotten man also means dealing with the reality that they can afford a life-saving, life-changing drug that 10% or more of affluent Americans take. But folks without means can't manage it. Secretary Kennedy mentioned New York City. Actually, the #1 zip code is the Upper East Side, which is where you have property. And folks who know ritzy areas buy important real estate there because those real estate properties are worth a lot there. That should not be the #1 zip code in America for purchasing GLP-1 drugs. It speaks to the fact that we have an inherently, innately unfair system that penalizes folks who can use these medications the most. Folks in the Rust Belt. Now, what are you supposed to do if the right thing to do for your health is right there, but you can't afford to get it? Folks need to be able to utilize these life-saving medications, and being fair about its distribution is essential. And we are democratizing access to these medications and dealing with a moral imperative to make sure that all Americans have access to avoiding all the obesity-related complications by making sure they can afford, if they do things right, not just MAHA-appropriate interventions, but also medications like this. In fact, we think these deals, and this part's very important, we believe these deals within 2 years, by the time the ink dries on these contracts that were signed earlier today, within 2 years, based on our health improvements, we will be budget neutral. These drugs will not cost us money. The American taxpayers will be getting their money back. That's how important it is for us to reduce the cost of healthcare in this country, especially when it's due to preventable problems like obesity. In addition, we have an update, Secretary Kennedy. We thought it was 125 million pounds. Mr. President, our estimate, based on the company numbers as well, is Americans will lose 135 billion pounds by the midterms. But I don't measure it in pounds. I measure it in saved lives. People can sleep again because they can breathe as when they go to bed. Folks whose knees don't hurt. People who don't have heart attacks, renal failure, dementia, all the things we know are associated with obesity and much more. This wouldn't have happened if we didn't have the right tools and had the ability with a team that has been spoken of early. So I want to call out Abe Sutton. He's in the back right there. He leads the CMS Innovation Center. It made the deal possible. And they are announcing today a new model, a brand new model aimed at getting to the vulnerable populations amongst us these medications. The forgotten man will be able to afford these drugs now. Governors will be thanking President Trump. They should be calling directly, sir, because they're going to be able to afford Medicaid next year in ways unimaginable, and they will stop crowding out education and other civil services. We cannot be a wealthy nation without being a healthy nation. That's why today's MFN deal is a historic step forward for all America, and this is something that I don't think is partisan. There is no way you can argue against what just happened. These numbers to my side here, that's just Administrator McCary, who's been instrumental in this process as well. $1,350 baseline. Chris Klump will go through the numbers, but just focus on that 245, which is what he's going to point you to. And Chris Klump has been an unbelievable leader, an innovator. You've heard his name before. He's spoken here before, but he is continuing to change the face of CMS. And I love the fact that with his leadership, we're bringing a lot of wonderful people in. Inma Hernandez has been mentioned, John Brooks as well, and many others, including Beth Kelly, who runs the legal issues around these issues, because these guys are barracudas, Mr. President. They will take you down, slice you in little bits. And Howard's been there. It's no longer happening. You've got sharp folks. We're open for business. It's a generational opportunity to serve, and people are showing up.
It's a pretty clear attempt to brand this whole thing as part of a larger positive movement. And of course, there was the all-important money question. Who's paying for this? Well, they claim the whole program would become budget neutral within just 2 years, meaning it wouldn't cost taxpayers a single penny in the long run. The logic was that the savings from lowering prices on other drugs, like for diabetes, would completely offset the costs of these new weight loss treatments. And that brings us to the very end of the broadcast, which, honestly, is the part most people will probably remember. Because just as a pharmaceutical CEO was taking the stage, the whole event went completely off the rails. The CEO of Eli Lilly, one of the big pharma companies, walks up to the podium. He gets just a few words out, and then, boom. Mid-sentence, the live feed just cuts out. It goes dead. And for everyone watching on the stream, it was just chaos.
It's truly an honor to be here today for this historic step forward, to expand access to a class of medications that can fundamentally change the arc of chronic disease in our country. Of course, these are the incretin or GLP-1 agonists that we've been speaking about. For nearly 150 years, my company, Eli Lilly, has been investing in America. We've been advancing science and creating high-value jobs. But today, you okay? Gordon, you okay? Yeah.
Press out. Press. We're going. Thank you, press. Press. Right, guys. Cameras. We're done with you. Cameras.
From his perspective, it looked like someone might have collapsed on stage right before the signal died. You can hear him shouting, "Uh-oh, we're losing him. Man down, man down." And his audience was just left completely stunned with no idea what just happened. So when you step back, what you have is this major policy announcement about drug prices that got totally swallowed up by the absolute chaos of live broadcasting. It's really the perfect example of our modern media world, and it leaves you with this one big question. What happens when the substance of a message has to compete with the spectacle of how it's delivered?